I decided to do an MDCM and PhD program because I truly believe in the synergy of medicine and research. Also, I envisioned my life as a doctor, or a pure doctor, and I wasn't entirely satisfied, and I did the same for pure researcher, and I also wasn't satisfied. And I realized that this program really offers the best of both worlds. I decided to study at McGill because the program structure really appealed to me. The fact that you have the PhD in between the two halves of medicine made the most sense to me. But also because in terms of brain imaging, which is what I do for research, McGill is really a world leader. So to me, this was the perfect place to be. I think for anybody in the MD PhD path, the biggest challenge is the fact that at every step of your training, you are competing against people who do what you're doing full time, which means that you need to perform equally or even better with less time. And I feel that that is a really big challenge. I study kids who sustain concussions. Sometimes concussions can be very subtle, and usually a doctor might pick up a brain scan and try to detect damage. But when concussions are subtle, damage might not always be there. So these children, once their symptoms get better, they might be told to return to the same activities, be it hockey, football, etc. They might be told to return to those activities that caused their injury, putting them at risk for further damage. What I'm trying to do is use advanced forms of brain imaging to detect these very subtle forms of brain damage to ultimately inform clinical management, so inform diagnosis and prediction of clinical outcomes. I see myself working as a pediatric neurologist, treating a variety of different brain disorders, not only just concussions. The most important aspect for me is to be able to use what I find in my research to be able to offer more to my patients. Although the program really keeps me busy, I often find time to engage in things that I'm passionate about. So for instance, I founded this organization that works to educate future doctors to recognize the signs of human trafficking in their patients. On a lighter note, I also like spending time with my 3-year-old daughter. She is really energetic and she really keeps me busy.